Hi, we all know Z is the end of the English alphabet, and then comes A in the loop, which is the beginning of the alphabet. Similarly, when life hits the roadblock due to damage of our kidneys, which is the vital organ of our body, then life becomes critical. But if you get the timely treatment by a specialist, then you can re-enjoy your life with your loved ones without any complications. Good morning. I'm Hamsa, your host for today on ZTalk, a public awareness initiative to educate all of us on how we can protect our kidneys from damage to live a healthy life. Because if we damage our kidneys, then we all know the consequences. And if in case the kidney is already damaged or having some infections, then we want to know how we can lead a normal life. Today, to educate all of us on what's right to keep our kidney healthy, we have with us world-renowned kidney specialist. I welcome Dr. K.L. Arun on our special series on ZTalk.
Good morning, everybody. Thank you for this opportunity to share a few thoughts about kidney disease.
Good morning, Doctor. Doctor, we all know that to keep our kidney healthy, walking is a good exercise. So shall we walk and talk? What do you say, Doctor?
Definitely. Walking is good for everybody, and it's the simplest and the easiest form of exercise one can do. Walking early in life helps you in keeping active even in later life and makes you non-dependent in your elderly life. So make it a habit to walk regularly and let us walk the talk.
Fabulous. Doctor, before we begin our talk on kidney health, kindly let us know what do you do to keep yourself so healthy, because you are the role model for your patient.
First thing I would say is do as I say and don't do as I do. We all try to keep ourselves healthy, we try to keep ourselves fit, but many a time we fail because of our lifestyles. So walking is a good exercise, but any form of physical exercise for at least 1 hour, 3 times a week may keep you fit for a healthy life.
Doctor, what is the role of kidney in our body and why kidney health is important, and how common are kidney problems?
Kidneys are essential for life. We never tend to think about the kidney. Rather, we like to learn about so many things and we forget about the small things in life. As Kuvenpu put it, ಆಕಾಶದೆತ್ತರಕ್ಕೂ ಹಾರಬಲ್ಲ, ಸಾಗರದ ಆಳಕ್ಕೂ ಈಜಬಲ್ಲ, ತಾನಾರೆಂಬುದ ತಾನರಿಯ, ತಿಳಿದು 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 ಕೊನೆಗೇನೂ ಗೊತ್ತಿಲ್ಲ. The more knowledge we earn, the more understanding we have of the function of the organs. We all think the kidneys have a small role in just trying to throw out the various waste from the body. What we don't understand is it's not the throwing out of waste that is important. It is also that there is something called the internal environment. We all talk about the external environment. We talk about keeping the environment free of pollution. But do you think that if you look inside your body, every cell exists in its own environment? It is that environment which has to be kept free of pollution, which has to be kept clean. That is where the kidneys come in. The kidneys clean the internal environment and keep the body going in a healthy way. I don't know how many of you have really seen a movie called Inner Space. It was in various channels recently also. So in that, you see that when the terrorists attack a place where a space expedition is being planned, and for this space expedition they have miniaturized the human being and put him into a syringe. And the saga of the movie is about how this miniaturized individual is injected into another person and how he looks at the whole blood circulation and the organs within the body. That is what every cell in the body goes through, and that is maintained by the kidney. Incidentally, the kidney is also needed for maintaining your hemoglobin levels. It is needed to keep your bones healthy, and it is needed to keep your body free of many waste and acids that are produced when the body works to create energy for you.
Fabulous, doctor. Doctor, what are the common causes of kidney disease?
The common causes of kidney disease have been changing with time. If you had asked me this question about 20 years back, it would have been different. But today, things have changed, and diabetes has become the major contributor for most of our patients with kidney disease. If you go to any urban hospital, almost 60 to 70% of the patients would have had problems with their kidney due to the diabetes. Whereas maybe a little lesser in the rural places, but still, as a disease, diabetes is the main contributor for kidney disease. The next contributor many a times is thought about as hypertension, but we'll come to the discussion later when whether hypertension causes kidney problem or it's the kidney problem which presents hypertension. The other diseases which are commonly faced are what we call as interstitial nephritis, wherein the various toxins and poisons we use, including medicines, can cause damage to the kidney. When you look at as such kidney problems, the so-called kidney failure, there are two main things, that is acute kidney injury as well as chronic kidney disease. Diabetes is the commonest cause for chronic kidney disease. But when it comes to acute kidney injury, which is many a time reversible, the commonest causes are infections, can be a dehydration due to probably loose motions, or it can be due to drug ingestion and various medicines that we use. Things like snake bite and all have taken, thankfully, a back seat nowadays.
Doctor, how will a patient know if his or her kidney is damaged? Are there any common symptoms?
The kidney is protected in such a way that hardly any symptoms occur till the last 10 to 15% of the kidney is functional. So this leads to challenges in diagnosing kidney problem. The easiest way to diagnose a kidney problem would be a urine examination. If a urine examination is done in the school children, many patients with kidney diseases can be picked up. If the teachers in primary schools are taught how to do a simple dipstick urine test, then you can pick up many children with kidney disease. The other important presentation of kidney disease is blood pressure. Measuring blood pressure should become a part and parcel of every clinical examination. When was the last time that your doctor checked your blood pressure when you went for any other problem? So if that simple things are done, we can pick up many diseases. The other thing is, if you want to call it as symptoms, it can be in the form of multiple types of getting up at night or having urgency in passing urine. Even these small symptoms should be given enough importance, and only then will you be able to pick up kidney diseases early.
Thank you, doctor. Doctor, what are the common presentations of kidney disease?
Kidney being important in maintaining the overall health of the body doesn't have its own symptoms. Say, unlike a heart or a nervous system where you have developed specific symptoms to that organ, that doesn't occur in kidney disease. So it can be in the form of small things like swelling of the feet, or later on it can be breathlessness, and much more important is things like tiredness or weakness. See, kidney is needed for producing blood. So once there is kidney disease, the the amount of blood in the body also, that is hemoglobin also comes down, which we commonly call as anemia. These can be the symptoms of kidney disease.
Doctor, does kidney health impact the vital organ like heart?
Yes, kidney is needed, as I told you, to keep the internal environment healthy. And any change in internal environment obviously leads to malfunctioning of all the other organ systems. If the kidney fails, the presentation is that of a heart failure, because the heart is unable to take the load once the kidney is not excreting enough fluid. Similarly, when the kidney function comes down to such low levels that the urea is high, brain cannot function properly. Similarly, things like sodium, which are maintained by the kidney, if they become low or high, then also the functioning of these organs is affected, and you have multiple problems, including unconsciousness, coming up in these patients.
Doctor, what is the relation between hypertension and blood pressure with kidney?
Yeah, this reminds me of the Trimurtis, Brahma, Vishnu and Maheshwara. We all, if I ask you, how many temples do you know of Vishnu? I am sure you will tell me 1,000 temples, right from Tirupati to Tiruvananthapuram to so on and so forth. And if I ask you about Ishvara, you would give me a huge list, right from Amarnath to Rameshwaram. But when you ask about Brahma, how many temples are there? Hardly any. Yeah, people may remember one in near Mount Abu or one near Tamil Nadu, but these are all very limited. The relationship between kidney and blood pressure is the same. Blood pressure, even the so-called essential hypertension, is because of involvement of the kidney. If the kidneys were totally all right, then the blood pressure wouldn't even have gone up. So, hypertension is caused by kidney, maintained by kidney, and can be a manifestation of kidney disease also. So, maintaining the blood pressure is one of the major important parts of kidney function.
Doctor, we take medicines to treat disease, but are there any drugs which are harmful to kidney? And if I take medicine, then how do I protect my kidney?
See, every medicine that you use will do changes in the body. You take a medicine to change what is happening in the body. And once you take a pill, there is no way you can control what it does inside the body. See, it's always, we see people, even if they have a small, what we call ugur suttu, you talk to 10 people before you get it opened. But you just go to the medical shop, ask for a tablet and swallow it. But do you understand that you can't control what the tablet does once it goes in? Every medicine changes what is happening inside the body, and that's how it works. The second thing is, the kidney's main function is to excrete most of the toxins with minimal fluid. To put it in simple terms, the kidney faces about 1,000 times the concentration of any chemical or any medicine that goes into the body. So, when you take a tablet, the kidney definitely is affected, and every tablet does affect the kidney. So, you have to be careful when you use tablet. Obviously, we can't live without tablets, so we'll have to take them. So, be careful in what you take and don't take tablets unnecessarily, whether it is for improving your immunity or whether it is for a small pain that you have, which could go off with a little balm to the part of the body. So, avoid taking tablets. Yes, if you are essentially on tablets, you will have to take them, and when you take them, kidney will be affected. So, the doctor will decide the dosage at which the kidney will not be affected, but the medicine is beneficial to you. Many a time we will have to give medicines which can harm the kidney. But when we give that, we have ways of preventing that from damaging the kidney. These medicines are also to be used together when the doctor decides that there is a need for it.
Doctor, how do you assess whether the patient needs a transplant or a dialysis?
The body protects itself in such a way, and the kidney being so essential, that you hardly find any problems till about 10 to 15% of the kidney is functioning. Once it reaches that stage where about less than 50% of the kidney is functioning, then life becomes difficult without support, which we call as renal replacement therapy. The forms for renal replacement therapy obviously are dialysis, and we can't match what nature gives us, and hence transplantation is the one which gives a better quality of life to the patient. Can we decide on when a patient needs dialysis just on basis of numbers? No, it's not. Because every patient is different, and there may be a patient who may need dialysis even at a creatinine of 3. At the same time, there are people who can tolerate even a creatinine of 15 or 18 and continue living healthily. So it depends on the individual, depends on the disease he has and how it progresses. So the decision when to start dialysis will have to depend on the clinical picture of the patient, and the doctor will be in a better position to take the decision and not dependent on the numbers that you get from the lab.
Doctor, is there any food items or diet which is harmful to kidney, and are there some foods which are beneficial to kidney?
It's a old saying in Kannada, ಊಟ ಬಲ್ಲವನಿಗೆ ರೋಗವಿಲ್ಲ. So if you know your food, you can be free of any disease. Treatment starts with diet, and medicines come only after diet. So if your diet is not all right, giving 1,000 medicines is useless. I'm sure all of you have seen ads that where you take an extra tablet and check your blood sugar. That is the most harmful thing you can do to your body. Knowing what to eat and what not to eat is the first step in treating your disease. The home food cooked properly is perhaps the best thing that can happen to you. Outside food contain so much of extra things that are added just to add to the taste. It can be in the form of salt, it can be in the form of oils, it can be in the form of preservatives. All of these are again chemicals, and any unnecessary chemical going into the body will definitely cause damage to the kidney. So knowing your food, knowing what you eat and learning how to eat is what keeps you healthy in the long run.
Doctor, does patient comes to you directly at any time, or they're being referred to you, and due to this there is a delay, and does this cause any life-threatening conditions in the patients?
Sadly, we do get a lot of patients who come to us directly. If the recognition had happened earlier, it would have been better for the patient. Thinking of kidney disease, both from the patient's part as well as the doctor's part, would help the patient getting treatment early on. Early treatment is what is essential. Sadly, most of our patients come to us with about 10 to 15% of the kidney function remaining. There is nothing much we can do at that stage except offer them dialysis and transplantation. But if they were referred to us when the kidney function started going down, probably we could have helped them in prolonging the life till the need for transplantation or dialysis arises. Thinking of kidney disease at every step, it can be a small abnormality in the urine test that was done for something else, or a scan done probably for pregnancy showed a few changes in the kidney. If these were picked up early on and referred to the nephrologist early, it will help the patient in the long term. The other thing is, there is a feeling that if you refer a patient to a specialist, the patient will not come back to the practitioner. That should go. The specialist wouldn't like to do a day-to-day treatment for the patient. The family physician still has to be the backbone of medical therapy, and it is both for the patient and the doctor to realize that you seek a specialist intervention once for diagnosis and to get a guideline of the treatment. But giving the day-to-day treatment will still remain with the family physician.
Doctor, what's your message to our viewers on why and how they should take care of their kidneys?
Kidneys will function as long as you don't overload them with problems. A healthy lifestyle, a proper diet, preventing damage to the kidney by adding toxins will go a long way in preventing kidney disease. ಡಿ.ವಿ. ಗುಂಡಪ್ಪನವರ ವನಸುಮ ಕವಿತೆನ ಹೇಳ್ತಾ ಕಾನನದಿ ಮಲ್ಲಿಗೆಯು ಮೌನದಿಂ ಬಿರಿದು ನಿಜ ಸೌರಭವ ಸೂಸಿ ನಲವಿಂ ತಾನೆಲೆಯ ಪಿಂತಿರ್ದು ದೀನತೆಯ ತೋರಿ ಅಭಿಮಾನವನ್ನು ತೊರೆದು ಕೃತಕೃತ್ಯತೆಯ ಪಡೆವಂತೆ like this flower in the forest which blooms behind the foliage, and only when it dies does the smell of that rotten vegetation come around. Similarly, the kidneys work silently. They do not have the beat of the heart. They do not have the reflexes of the nerves. They do not have the size of the liver, but functions continuously to keep the environment healthy and the person healthy. So let us do our utmost in trying to prevent damaging the kidney, recognize kidney disease early, try to treat it as much as we can, and slow down the worsening even when you have kidney disease. Thank you.
I'm sure, Dr. Arun, your valuable advice will really help all our viewers in keeping their kidney healthy. And special thanks to you for taking out time from your hectic schedule and be a part of ZTalk, which is the initiative with Indian medical fraternity to make more and more people aware about the menace of kidney disease. And I'm sure your advice will help in by early diagnosis of kidney disease.
Thank you.
Thank you, viewers. Do like, subscribe, and follow our ZTalk page on YouTube and Facebook, and stay connected for the right information from the leading and renowned kidney specialists of India. Thank you again. Stay connected for the latest updates and experts' advice on ZTalk page in social media from the renowned nephrologists of India. Thank you.